Okay, today I want to talk about abdominal liposuction with etching. This is a procedure that is very hot right now. I have a lot of patients that are coming asking for this procedure. It's in the news, it's on Instagram, it's on social media, and it's a great procedure when done by the correct person and using the correct technique. So I just want to spend a few minutes telling my friends and my followers sort of what it is and what it's different and how it's different from standard liposuction. So a standard liposuction procedure, as most people know, is a procedure that is usually under general or local anesthesia. We put a lot of salt water, in layman's terms, we put a fluid, crystalloid solution, in the area that we're going to treat, and then with cannulas, which are long metal tubes, we take out the fat. And there's several different types of techniques and technologies that we use to do this. There's ultrasound liposuction and power liposuction and laser liposuction. That's standard sort of liposuction. Abdominal etching is a little bit different. It is liposuction, so for the most part, it's a smaller type of liposuction on a patient that doesn't have a lot of fat to remove. But in addition to doing the liposuction, we're going to be more aggressive in the natural boundaries of the abdomen to enhance the appearance of the underlying abdominal wall and abdominal wall musculature. The result is an abdomen that is not only slimmer, less fat, but also an abdomen that looks more athletic. You can begin to see the marks of the rectus abdominis, the obliques, which are the muscles that make up the abdominal wall. In my practice, my goal is to give my patients a very subtle result, right? When we try to be too aggressive with this procedure and try to give people a six-pack, it doesn't really look great, right? Because a six-pack is made up of lean, hard, solid muscle. If we do a six-pack with just fat, it doesn't look great. So in my practice, and most of you can see my patients on Instagram and other social media outlets, I like to make a subtle but very visible change, specifically on the lateral abdominal wall. And I'll show you guys in a minute. So the ideal patient is someone that has mild to moderate excess fat. So when I have patients that are a little bit overweight, I usually tell them to come back after they've lost some pounds, and that way they can get the best result when we do the etching. So I wanted to show a picture of a typical patient that I did. This is the front view and the side view. This young lady came in with, like I just said, she was an ideal candidate, mild to moderate excess fat around the belly button and in the flanks area. From the side, you could see that she had a little pouch. So we did liposuction, general liposuction in the entire abdomen and flanks. And what I did is I did the edging on the side, on both sides. This is the lateral border of the rectus muscle or the six-pack muscle. I also did a strong edging of the linea alba or the midline above the belly button. Okay, this is her front view result. This is her lateral view or her three-quarter view. As you can see, this looks natural. It looks athletic. It looks really good. I don't like making horizontal lines. Again, it doesn't look natural. So this is sort of an ideal candidate. The procedure itself is a standard surgical procedure. Usually takes in a patient like this about an hour. It doesn't take very long. We do it under general anesthesia. Patient goes home the same day. It's ambulatory. Recovery is just a few days. So after a few days, people can usually get back to work and their normal activities. I do use a lot of post-surgical massages. So I have someone in-house, but they don't have to use that person. And that person helps me out with the lymphatic drainage and helping me mark the edging so that by a month or so, patients can start expecting to have this result. Lastly, people say, "Doc, how much does it cost?" Right? So it's sort of like the bottom line and everyone wants to know. When it's in an isolated patient who only wants abdominal flank liposuction with edging, costs us about $6,000, and that includes everything that the patient needs. So that's it for my little synopsis of abdominal etching. If anyone is interested in finding out more about this procedure, I invite them to come to my practice, set up a consultation, and we'll discuss it in more detail. Thanks very much for watching.